Welcome to the Bare Naked Shrinks.
Hello, hello, and welcome to the Bare Naked Shrinks with me, Dr. Courtney, and my fabulous co-host, Dr. Dany.
Hi.
Today, we have a very special guest, Dr. Leslie Anderson. She is the Director of Clinical Training at UCSD. She's very special to us as she is Dr. Dany's best friend and the person that I learned DBT from and my former supervisor.
Thanks. Thank you.
So today, Dr. Anderson is going to be talking to us about DBT applied to eating disorders specifically, which is one of my favorite topics as well. So to start things off, let's get into our
cake and crap.
I think we mentioned in our last Shrinky Dink that we are filming this less than 24 hours later. So it hasn't been a ton of time. I think we're still going to talk about our cake and crap over the past 24 hours. So Dany, I think I told you that last night I was going to lesbian night at camp, which is like my favorite social hangout in Seattle. I went to that. And remember how I told you that I joined kickball?
Yes.
So I went out with all my kickball friends and it was a blast. It makes me more excited for my kickball team. So we all went to camp and had a great time and danced. And then we went to the Wild Rose afterwards, which is the lesbian bar in Seattle. So definitely the whole night I would say was cake for me.
Courtney, I don't think I knew that you were sporty. Are you any good at kickball?
No, this is why it's funny because I don't do balls at all.
Yes,
generally.
we had a whole joke about this last episode.
No. So the reason that it was so fun was because I mostly just like cheered, and my friend invited me to join and I was like, I don't do balls. Absolutely not. And she said it was mostly going to be a social thing. I'm having a great time. Some people are a little bit too competitive, but I actually scored a point. It was very exciting. And so my crap was probably that I got 3 hours of sleep. So I'm a little bit sleepy.
Oh my goodness. And you have a full day today, as I recall.
Yeah, it got even fuller since I've seen you last.
Oy vey. Okay, my cake is being here in San Diego with Leslie. I love coming here. We're in her guest house right now, and the daddies are taking care of the kiddos right now. So that's a nice little treat. And Leslie kindly made me a mimosa and brought it down, like the amazing best friend she is. My crap is, I guess, twofold. Lively is having tantrums, so I was running very behind this morning, and I was trying to clean up around here, and I threw out my back, full-on old lady back, throwing out. So that's why I'm kind of sitting weird. I have my knee up, so I can kind of crouch over. Yeah, so that's mine. How about you, Les? It is really fun having you guys here. And one of my favorite parts of it is watching our kids be close to each other and become closer to each other. So last night was movie night at the elementary school, and the girls took Wilder and introduced him to all their friends. And it seemed like he felt so cool. Yes, he just seamlessly fit in with all the big kids. So that was great. And then, of course, Augie and Lively are completely on the same page because they're 6 weeks apart in age. And so they just like are best friends whenever they're together. It's so great. Yeah, it's so cute. And they're so cute together. And then what about crap? I don't know if I've had any crap in the past 24 hours, but I'm allowed, you're allowed a longer span, right? Because this is my first time on the show. So I got back from Asia about a week and a half ago. I was in Thailand and China. So I guess the crap is just whenever you come back from a trip and you have so much work to make up and so many things to catch up on, and also jet lag. But I feel like it's all kind of settled out. So maybe that's actually cake now.
And were you in Asia, Leslie, to teach DBT or train people in DBT?
Yes, I was actually. So I went to China to speak at the first annual DBT conference of China. Cool. And I did a keynote address and then a workshop the next day. Were you like a celebrity to them? Well, they are super excited about DBT. Yeah, they do kind of treat me like a celebrity because I think they think I'm more important than I am. But it's really fun. It was a huge conference. There were 500 people at this conference, and it was very inspiring and felt like, wow, these are just such a passionate group of clinicians who are bringing DBT to China. Like, that's a tall order, right? That's a big country. So cool. Well, also, China is my favorite place. That's an unusual place for people to like, I guess, but I'm obsessed with China, like learning Mandarin, and my daughter went to a Mandarin preschool. I tried to tag along on this trip. I was like, hey, I want to come. And Leslie's like, It's a mother-daughter situation. Yeah. And I was like, well, I like a daughter. And I said it to Gail and to her sister, Geneva. They were like, you can come. I was like, nah, Leslie knows I'll suck all the air out of the rooms. I brought my mom, my sister, my daughters, and my niece. So it was a big group touring around in Thailand and China. So it was very exciting. We did so many cool things. It was amazing. I'll add some photos in of the trip to here.
Yes, please do.
She met elephants.
You've met elephants before in Thailand, I feel like, on a previous time.
I'm like Courtney, but I didn't have my kids with me. And of course, what I thought at the time was they would freaking love this and we got to come back. And then the pandemic happened and there weren't really many opportunities for a while. So it was exciting. This is my third time traveling to China for a DBT thing. Yeah, I'm really excited that I got to bring my girls and my niece and they got to meet the elephants and pet the elephants. My niece was pretty terrified of the elephant, which actually they're so nice and sweet and also humongous. Like it is pretty intimidating to hang out with elephants.
Yeah, how old is your niece?
9. She's a very wee 9-year-old. Well, I mean, any of us would be immediately crushed if an elephant decided to step on us. I'm like, and Clementine and Lola are the size of an elephant. No, yeah, of course. They could fend off an elephant, but...
Oh, that's so cool. Wow, just casually dropping, Leslie, that you gave the keynote address at the first China DBT conference, like NBD. We are going to talk about what everyone's essence DBT skill is. What do you think your essence is?
Over control. I mean, it's funny because when you asked me what my favorite DBT skill was, I was probably going to go for a wise mind. I don't know that that's my essence. I do think that maybe one could argue that my essence is middle path. I'm just not very extreme on almost anything. And that is the exact opposite of this lady right here, tends to live in all the extremes. Yes. Leslie, I remember one thing you said is that I am never, ever foot in the door. I'm always door in the face. Maybe that's my essence. Your door in the face.
Your door in the face.
Door in the face is not a DBT
It's not
skill.
a DBT skill, really.
It's a therapist strategy in order to get people to do what you want them to do. Oh, well, it's my life strategy for getting people to do.
Maybe Danielle is just non-dialectical thinking patterns, which also is not a DBT strategy.
It is not a DBT skill. It's actually the opposite of a DBT skill.
Exactly.
Maybe I need DBT, guys.
I'm not going to comment on that.
Okay, so what do you think, Leslie? She says middle path. What do you think Leslie is?
I think middle path actually makes a lot of sense. But the first thing that came to mind for Leslie was mindfulness of current thoughts.
Oh yeah, why is that the first thing that comes to mind?
Potentially because you wanted the questions before, and so you're thinking about things. And so you want to be mindful of what you say.
Yeah. You really do think before you speak.
You do.
You're the opposite of impulsive.
Exactly.
We are so yin and yang.
You guys are very yin and yang. How do you make this friendship work?
Well, I love to tell the story of how I became Leslie's friend.
Wait, I actually love this story. Will you please tell it?
And it probably lines up with that door in the face business.
Yes, it does. Please tell the audience.
So I have a skill of knowing who is going to be a best friend. Like I just sense it. I don't know if it's an energy, whatever. As soon as I met Leslie, I was like, new best friend. As soon as Leslie met me, she was like, get away from me, you sorority girl from Oklahoma who voted for George Bush. It's apolitical. I just like voted for like who my friends voted for. And I just didn't know anything. And Leslie literally said no to me so many times. And then finally, I think this is what happened. One of our other friends told Leslie, so Lawrence is, I think we talked about this, a really cool music scene and has a lot of like artists and bands and stuff. So this woman invited us to a party, or invited Leslie to a party and to bring any of your cute, cool friends. And she said, well, I don't know about, she didn't, I don't even know if she said cool. She just said, bring any cute friends. And I was like, all right, I'll invite Danielle, this girl who's been stalking me and wanting to be my friend. And Danielle is very cool now. I just wouldn't necessarily have said she was cool at the time because she was full on in her sorority girl era. I wore like Abercrombie and Fitch, like low-rise jeans and like camisole tank tops. And I had super long, parted down the middle hair. Wasn't it a Halloween party? It was a Halloween party. Because you showed up dressed as Camo Barbie. Camo Barbie. Camouflage Barbie. With a gun. With a gun that was decorated.
Was it a real
I
gun?
have a photo. I will show it in this episode.
Please do. Please do.
No, it wasn't real. Although I did have a real gun at the time. She used to talk about guns quite a bit. It was one of my most embarrassing bringing Danielle places. even to like these very gentle, like PhD in sociology students, she would tell them all about their gun and they would just look at me like, Leslie, who is this girl? But Danielle is so cute and charming that everyone was able to overlook the camo, the gun, and the Barbie costume. And then the rest is history. And then she was like, okay, this girl, I guess, can tag along because she really knows how to control a room.
So Leslie, what was like the breaking point for you where you were like, okay, yes, I can be friends with Danielle?
Well, I remember Why are you answering this question? Sorry, this is how we are.
Because it's Danielle.
The Rorschach, remember? You gave me the Rorschach. We had to give classmates various psychological tests to practice administering them. So I feel like I administered a couple different tests to you. She did. And I think what you said was, I have a very good episodic memory and she doesn't. That's, I think, partially why I'm answering too. I think she said, you were so much more complex than I thought you were. But it intrigued you, I think. That's accurate. And knowing you and how you probably scored on those psychological tests, I'm surprised it went that way instead of the opposite way.
I know. I'm actually kind of surprised too. You did some psychological testing on Danielle and you were like, this is why I want to be her friend.
That's actually not how I remember it. How I remember it is that's my narcissistic reframe. Well, it's not totally different from what you're saying. I just remember meeting you in your camo Barbie era. Can we call it that?
Yes. We are calling it the camo Barbie era for sure.
And then talking to Danielle over time and realizing how smart and how much depth and complexity she has as a person. And realizing maybe the camo Barbie thing is just a facade. And also maybe I can change the camo Barbie thing, influence it. Maybe. She did. I say she was my academic big sister. Because she's like from this academic family and she's all poised and just understands how to like do that world. And I was like, here I am. It's like, hey, when you get your PhD in, a patient facing field, like maybe tone down the camo Barbie like a little bit.
Maybe throw out those low rise Abercrombie jeans.
And she questioned me politically because she was like, I'm confused. Like, why would you vote for George Bush? And I had zero idea. Like, I had no idea. And so she started just like kind of educating me, not really forcing me down any path, but just leading the witness, let's say. And then also she was vegetarian. I was very anti-vegetarian. I was like, meat. I mean, clearly I was like from Oklahoma. And she was like, I'm very confused. You love your golden retriever so much, but yet you eat animals. I don't understand. And so it planted a seed. And then later I became vegetarian. I'm not pescatarian because when I was pregnant with Wilder, I needed salmon and I still to this day. So she's right that my episodic memory is not good, but I do remember her vegetarian moment, which was she said she was driving on the highway and somehow got behind a truck with a cow, like a cattle car. So many cows, many cows. One of them looked out, between the slats of the back of the truck and made eye contact. And that was it. That was it. I stopped eating meat then and there. I started not eating beef or pork or mammals. And then years later, stopped eating poultry. And then years later, fish. The cow looked at me. That cow changed so many cows' lives. It did.
I wish that you had a photo of that cow.
I wish. Mm-hmm. They had a connection.
Leslie, I'm curious what you think, but I think Danielle's alternate rebellion because of her ambiance.
Yes, I can definitely see that.
I think it fits well.
You're kind of alternate rebellion too, from what I understand. I'm not very good at DBT, but with your tattoos and your piercings, if you dressed differently, you would be punk Barbie.
I would have to dress quite differently.
Well, yeah, but I'm just saying with your piercings and tattoos.
I guess potentially you could argue that like, trying to fit into Seattle vibes, I'm like trending more towards punk Barbie. So there's that.
Yeah, you're still wearing colors though. That's like not a thing people in Seattle do.
That's true, but like solid colors a lot of the times though, which is different. Not at work, not on the podcast, but like last night I just wore a solid pink shirt.
She's like solid pink. I still bet you were the only person in that bar that wasn't wearing black or gray or brown.
I'm not gonna deny that statement.
Well, we talked about this in one episode, how we do like standing out. And so part of standing out in Seattle is wearing colors.
It's not hard to stand out in Seattle.
Thinking of Courtney in DBT terms, I don't know if this is a DBT skill per se. DBT is made for people who are under-controlled. They don't have a lot of control over their emotions, and that sometimes gets them in trouble because they don't know how to cope with their big emotions. And so they end up turning to possibly problematic behaviors. On the opposite end of that spectrum is people who are over-controlled and don't show a lot of emotionality and maybe hold things in too much and therefore sort of develop internalizing issues. When I first met Courtney, I thought she for sure was extremely over-controlled. That happens, right? Where you meet someone and you think they're over-controlled at first, but I was her supervisor for a full year and thought she was 100% over-controlled the entire year, meeting with her more than once a week, every week for an entire year. And then she did a rotation in a different area of our clinic. And when she came back, she was totally under controlled. And I was like, what happened? Like, did that other rotation change you this much? Or was it the thing where you like hold everything inside and then you have some of the emotions like come out volcano style? Or did you pull a fast one on me for an entire year that I thought you were over control? I think she did, because remember, there was one time I asked you via text message, were you pageant girl? And you were like, I can see why you might think that, but no, because you present like very but you started getting more vulnerable and being more open.
Well, that's it. I have a lot of social anxiety, and I was very excited to be at UCSD and very intimidated by Leslie. And yeah, wanted to obviously present well and stay there for postdoc. And so I think that contributed to me being like very put together and conscientious. And then once I learned more about DBT and bringing yourself in and got more comfortable, I was like, hi, this is me. Surprise.
Were you really over controlled at work and then you would go home and be under controlled? Or were you in, since we're talking about eras, were you in an over controlled era and then you were like, enough of that?
That's a good question. No, I don't think so. We should ask Alex Muratori, but I think she would say I've always been under controlled. I think I would go home and be very under controlled. I'm just good at like masking maybe my under controlled.
Hopefully Alex can be a future guest on this show and further dissect your personality style in DBT terms.
That would be fun. Now, let's get on to the educational portion of the day. Leslie is going to talk to us about DBT and eating disorders.
Rollercoaster.
Thank you so much for having me as one of the inaugural guests on your show. I'm always happy to talk about DBT, especially DBT for eating disorders. I work at UC San Diego in a partial hospital program. People with eating disorders at that level of care tend to have lots of other things going on. They may have tried outpatient treatment and it didn't work. So DBT has been a really fantastic approach for these patients because it is able to address lots of different things at the same time. DBT was originally developed by Dr. Marsha Linehan in Seattle, Washington, where Courtney is now. You're in the heartland of DBT, so to speak. And Dr. Linehan developed DBT for people with under-controlled emotions. So people who have a lot of emotions, they don't really know what to do with them. They don't really know how to cope with them. And so they end up using problematic behaviors, potentially things like self-harm, thinking about suicide as a way to end their problems, substance use. And more recently, we've started thinking about how eating disorders can be actually a way to cope with under controlled emotions. So how would that work with eating disorders? I think when you look at behaviors like binging and purging, even if you don't have an eating disorder, you've probably noticed that coming home after a really hard day and eating, maybe more ice cream than you normally would might calm you down and feel pretty good. So of course, our patients with eating disorders tend to be people of extremes. So they probably realize the same thing. And perhaps that's how you fall into a pattern of binge eating. Purging, some people talk about how that gives them a little bit of a sense of control over their emotions, or perhaps purging is just a way to deal with any guilt and shame that you might feel from binging. And then restricting food, how would that help with controlling emotions? People talk about this in different ways. For one, a lot of people who have restriction as their primary behavior are pretty over-controlled. They're not showing a lot of emotionality. And that's accurate until perhaps you try to talk to them about weight restoring or sticking to a meal plan, at which point you might see a lot of emotions come out. So you could imagine how coping skills for that emotion might be helpful. Similarly, people with anorexia talk about how they have a lot of high baseline anxiety. Even if you don't have an eating disorder, you can probably think about how when you're super, super anxious, you just don't want to eat. It messes up your appetite. It doesn't feel good. It's just not what you want to do when you're really anxious. So not eating could actually be an effort to control those high levels of anxiety. I want to say something. Sorry, I said I was going to get out of the frame, but no, I'm not.
She can't stay away.
This goes back to my neurobiology episode where under eating controls a greater amount of serotonin and the synaptic channel which too much serotonin makes you anxious. So they actually are effectively controlling anxiety.
So DBT obviously has a lot of different skills that we teach people to use to cope with their emotions. Two of the really important aspects of DBT are the biosocial model, thinking about how somebody might have developed a pattern of pervasive emotion dysregulation. Thinking about the biosocial model, I always show people when I'm doing trainings this sort of diagram or flowchart of how pervasive emotion dysregulation might develop from a biosocial standpoint. And basically what happens is that you have somebody who's born with more emotions, right? Like some people are born with more emotions, some people are born with less of a maybe emotional reactivity or a capacity for feeling strong emotions. And it varies biologically. It's just a temperamental difference that people have. And people who are born with a high level of emotionality and are then put into an environment that in some way invalidates those emotions. So perhaps the environment tells them you're not supposed to feel that way, you'll get punished if you feel that way, or an environment that just ignores their emotional needs. Sometimes people in that type of environment will get louder, like, hey, I really need help. I really need you to acknowledge that I'm feeling these emotions. Sometimes they'll get quieter and turn those emotions inward, but the emotions have got to go somewhere. And the more they're in an invalidating environment, the more dysregulated they become, not learning how to actually cope with their emotions. And the visual that hopefully is popping up right now shows how this works in terms of babies or toddlers who have more emotion dysregulation. I used to have a stock photo of a random toddler from the internet crying on here. And then around 11 years ago, I replaced it with a photo of my oldest daughter, Clementine, because as a baby and toddler, she had extremely big emotions. She was my first kid, so I didn't even know that I realized how extreme she was, but I definitely have some memories of being on the playground and her throwing these really epic tantrums and all the other nice, well-behaved toddlers just looking at us like, what's going on? And the thing about Clementine and her big emotions is I think she's an example of if you're not in an invalidating environment, having big emotions isn't necessarily a problem. It can actually be a really cool thing. So I was talking to somebody yesterday and I was telling them about Clementine and her emotionality. And I was like, she's doing really well now. She doesn't have pervasive emotion dysregulation, but she's really into musical theater. And then I just had this light bulb moment where I was like, if you have really big emotions, there's only two paths. Either you're pervasively emotionally dysregulated or you're a musical theater kid. There's obviously more than two paths, but it was a funny way to think about things because, man, if you're in musical theater, like you have to have some big emotions that you can show up on stage. Anyway, that's a tangent.
What an effective way to use those emotions, though.
Exactly. And I think part of what is so wonderful about her is her emotionality and her ability to connect with people with her emotions.
But also talk about the validating environment. What did I just say this morning? She literally came out of her room and she goes, hey, Mom, I'm going to do my homework and then I'm going to check on my grades. And I looked at Leslie and I was like, what the? And she was like, I know. And I was like, she's such a dream. So she's really, really high functioning, even though she's emotional because she's been validated.
And I think that her emotions are actually a beautiful thing. I remember when I told Clementine that I was pregnant with my 3.5-year-old son. I told Clementine and Lola at the same time. And Clementine, she started very loudly, both crying and laughing at the same time. And she kept it up for probably a full 15 minutes. And it was really, I've never seen anybody do that. And I was like, okay, you are having a lot of emotions right now. She was crying from happiness and laughing from happiness, but doing both at the same. I mean, have you ever even seen someone do that? It was so cool. And it was like such a fun, beautiful memory of how excited she was and still is about her little brother. So biosocial theory, we have people who do end up not knowing what to do with all of those emotions and falling into perhaps accidentally behaviors like eating disorder behaviors to try and control their emotions. And those behaviors work quite well in the short term because when you engage in a behavior that numbs or distracts you from your emotions, that feels good. That feels like you've got control over that emotional experience. But of course, it doesn't do anything in the long run to teach you how to deal with emotions. It doesn't help you solve whatever the underlying problem was. So that's where we come in with all the DBT skills. And there are a lot of DBT skills. I haven't counted. Courtney, do you want to guess how many? I really don't even know. Are we in the hundreds? Are we in the thousands?
At least hundreds. At least hundreds.
At least hundreds. One of these days, I'm going to count and see how many DBT skills are there. They fall into 4 categories. So we teach people about mindfulness. We teach people about distress tolerance. We teach people emotion regulation. So how do you maybe even out your emotions if you're someone who is on a roller coaster of emotions? I'm looking at you since I think the name of this episode is Rollercoaster. I still haven't heard that song, by the way. Oh, and I need to listen to it.
I'll sing it for you.
Great.
I'm sure she's going to sing it for everyone, actually.
Maybe Clementine could sing it for us.
Yeah.
So if you have those roller coaster emotions and you want to try and even them out, you can use DBT skills like emotion regulation for that. There's also a whole section of skills about interpersonal effectiveness and how to get your needs met in relationships without unnecessarily causing conflict. So because we're specifically talking about skills for people with eating disorders, I thought we could actually practice a skill, which is mindfulness of eating. Also, I wanted to practice this one because it is overwhelmingly the favorite DBT skill to practice among people who don't have eating disorders. Whenever I do a training, people are like, yes, we get to mindfully eat chocolate. And anybody can practice this skill at any time with any food. So if you're listening to this podcast right now and you want to try to eat something mindfully along with Dr. Dany, who's going to be mindfully eating chocolate, then you totally can do that. So we're going to practice some mindfulness of eating. But let me give you a few caveats. I like to use mindfulness of eating with anybody who is struggling with binge eating. I think it's a great way to learn a completely different way of eating. When you're binging, by definition, you're eating quickly. You might not even be paying all that much attention to the food that you're eating. You might be barely tasting it, and it feels pretty out of control. So mindfulness of eating is a great way to learn to slow down and really engage all of your senses with the food that you're eating. With people who struggle primarily with restriction, I think mindfulness of eating can be a really helpful skill to learn maybe later in treatment, because part of mindfulness of eating is not judging the food and not judging the experience and not judging your emotions while you're eating. And those are all really important things for people with anorexia to learn. But at the beginning of treatment, I think the focus really needs to be on weight restoration and sticking to a meal plan. And so mindfulness of eating might end up being a little bit of a distraction for that. If you have a patient who struggles with binge eating, or if you just want to learn mindfulness of eating, we're going to go through and I'm going to show Dr. Dany how to do it. I brought some Hershey's Kisses. I don't know why this is just always the food that I end up landing on for mindfulness of eating. So there's your Hershey's Kiss. You're eating some chocolate mindfully with us. What is that?
The dark chocolate covered power berries from Trader Joe's.
Those are so good. Oh, I just judged.
Don't unwrap it yet.
I just did a judgment.
That they're so good,
Uh-huh.
right? Okay, how would you reframe your judgment?
I've had those before and I enjoyed them.
Wow, great job.
That was a great job, but my first thought was, you don't have to sound like a robot if you're not being judgmental.
I feel like that's also a judgment there.
That's
Leslie.
how
It's also a judgment.
that's how hard it is for me to be controlled or DBT-ish.
To be controlled. That's what DBT is all about, is trying to control people. So what you did that was reframing it is that instead of saying those are good as though everyone in the world agrees with you, you switched it to your opinion. I enjoy them, right? And so actually you do that all the time. You give your opinion all the time. So let's mindfully eat our chocolate. Dr. Dany, I want you to start by holding your Hershey's Kiss in your hand. And I want you to just observe it. Look at the light and how it bounces off the wrapper of the Hershey's Kiss. Notice the weight of the Hershey's Kiss in your hand. Notice the little tag sticking out and which letters you can see. You could touch the Hershey's Kiss and feel the texture of the chocolate through the wrapper. And you could smell it and observe the scent of the chocolate with just your sense of smell. And then when you're ready, I want you to slowly unwrap the Hershey's Kiss and really focus on your sense of hearing. What does it sound like as you unwrap the Hershey's Kiss? Ooh, extra sound. Very beautiful. And then hold your chocolate in your hand and again, look at it. Notice the texture. Notice the weight of it. How does it look different without the wrapper? And you can smell it again and notice if the scent is any different now. Notice if any urges are coming up. And when you're ready, go ahead and put the Hershey's Kiss in your mouth, on your tongue. Don't start chewing it right away. I want you to, at least for a few moments, let it rest on your tongue. You can close your mouth though. So notice how the Hershey's Kiss feels in your mouth. it's probably starting to change texture and shape. The scent of the chocolate is probably getting really strong in your nose since taste and smell are so connected. And then you can notice the taste of the chocolate as it swirls around your mouth to the different areas of taste buds. And think about maybe how you might describe this experience to someone who had never tasted a Hershey's Kiss, maybe even someone who never has encountered chocolate before. How would you describe it to them without using any judgments? So not it's yucky or it's yummy, but instead, how would you actually put words to that taste and smell and overall sensation of eating this particular food? And you can chew it whenever you're ready, but still continue to notice the texture, the meltiness. Oh, maybe that's a judgment. The degree of meltedness, the taste as it swirls throughout your mouth, and can you still smell it? I think sometimes it's funny how the sense of smell changes over these moments. And then as you finish chewing and swallowing the Hershey's Kiss, you can probably still taste it for many moments, many seconds in your mouth. And just be aware of how that taste continues to be present or starts feeling different over time. So I am really curious to hear both of your observations about what you noticed with eating a Hershey's Kiss this way. Obviously, this is probably not how you normally eat Hershey's Kisses. Although, Courtney, I know you've practiced mindfulness of food before.
I'm trying to say this very non-judgmentally. I do not prefer sweets.
That's not a judgment.
I do not prefer them. So the taste and the experience was pretty intense. I think if it were maybe dark chocolate or bitter chocolate, it would have been different. So I was just observing like, oh, your mouth does not experience super sweet chocolate very often, and this is an unusual taste, actually. The sensory experiences I enjoyed, the smelling and the sound and the touching. I feel like I would really enjoy doing those things more as a mindfulness skill. I feel like there's just certain sensory experiences that are more soothing to me.
And I think there's a myth about mindfulness that you're always supposed to enjoy what you're being mindful of. And I probably would practice mindfulness of eating, usually with somebody eating a food that they preferred, at least at the beginning. But mindfulness is about being mindful no matter what the moment is, whether you like it or don't like it or prefer it or don't prefer it, and fully being okay with that moment just as it is, even if this is not your favorite taste sensation.
Okay, I have a question about that. I didn't know Leslie was going to bring the Hershey's Kisses to the guest house. And so I was thinking, gosh, do we have any food down here? And my son is obsessed with Takis, like every flavor of Taki. And for those who are not from East LA, Takis are all the rage with kids, and they are extremely spicy. I don't even know how my 8-year-old deals with them. So I was like, oh, that would be interesting to do that, because that isn't a preference that I think a lot of people have. So do you ever do this with a really strong thing or like an Altoid or something?
So I think it'd be really fun to do it with something like an Altoid. What I'm usually doing is practicing mindfulness of food with somebody with a food that they either want to learn to eat non-judgmentally or a food that they often binge on. And obviously a lot of people binge on chocolate, right? So it's always interesting to try doing this exercise, because some people realize, I thought I liked these, and actually that taste isn't really what I prefer. I just used to eat them so quickly that I could barely notice how they tasted. Other times people will say, I enjoyed that so much, and it took, 5 minutes to eat that Hershey's Kiss, and normally I could eat 5 Hershey's Kisses in 1 minute, right? And so, wow, that experience of enjoyment could actually last a lot longer if I paid more attention to it. So I think it goes both ways, that maybe there's certain foods that you like more if you eat them mindfully, and certain foods that you realize, well, actually that isn't my favorite if you eat it mindfully. But with my patients, I am generally focused on foods that they tend to binge on, and how can we slow that down and truly enjoy what you're eating rather than eating it so quickly that you kind of miss half the experience.
That makes a lot of sense.
Courtney, how was your chocolate-covered power berry when eaten mindfully?
Well, I prefer them, and so I found it delicious. And I think every time I do this activity, it does really bring up for me how much more my senses are engaged when I slow down and eat mindfully, because I don't think I do that frequently. I found that it was very pleasant for myself. And one thing that I was observing when you were mentioning, Leslie, about how you would describe this to someone, it's interesting because I found that to be challenging, and I enjoyed that activity for my brain to think about how would I describe this non-judgmentally to a person that is not experiencing this in the moment.
Like that too, especially I feel like I can put words on the sense of sight. I can describe how things look, but it's very hard for me to describe how things taste or smell. I just don't even have much of a vocabulary for that.
Outside of the basic, like sweet, bitter, sour, umami.
Well, and I was even thinking, because sweet kind of came to mind for me when I was eating this. If someone doesn't have that much familiarity with taste,
after not having a sense of taste or smell, do those words even mean anything?
yes. And that's what I was thinking. Like, if I say sweet, would everyone know what I'm indicating when I say that? I don't think so.
Yeah, it's funny. I guess it's the same for sight. Like if you can't see, then all of those words we use to describe how things look might not be very meaningful. Well, this conversation has taken a turn. Now we're just having these philosophical discussions about people who don't have senses.
I feel like this is what DBT does. Like, it leads you down interesting philosophical conversations.
It does. And honestly, that is something I love about this particular treatment is it challenges you to think about things in such different ways. And so whenever I'm doing DBT with my patients, we do end up having pretty interesting philosophical discussions about stuff.
That actually was going to be a question for you, Leslie, that I know this is a little off script, but I am curious. What are the things that you really enjoy about DBT? What contributes to you still making this a big part of your career?
Great question. I think there's a lot of things I like about doing DBT. So in many therapeutic approaches, the therapist is encouraged to be a bit of a blank slate and leave their personality at the door so that their patient can perhaps project whatever issues they're having with other people onto the therapist. And that didn't really resonate with me as an approach. I've always wanted to bring my personality into therapy a little bit more, and DBT really encourages you to bring who you are into the room with your patient. You're in an actual real relationship with your patient. You're not just a proxy for that person's other relationships. I really value realness and genuineness, and I think that those are strong values in DBT. And then DBT encourages irreverence, which is being a little bit funny or saying things in an unexpected or offbeat manner to try and help your patient see things from a different perspective, which I absolutely love. I don't think that therapy needs to be serious and dry all the time. I think it can, have a little bit of spiciness to it.
That's exactly how I feel about DBT as well. I love that I get to bring my entire personality into the room and just be myself and also bring that spiciness. And I think that spiciness is what really makes us DBT therapists enjoy our jobs and also be pretty effective.
So should we call it talkie therapy?
Oh my God.
Leslie's aces with the puns.
Gosh, it is talkie therapy. That's our new hashtag.
Okay, let's transfer to the interview the experts.
Interview the expert.
Leslie, why don't you tell us a little bit about where you're from, where you grew up, what brought you to San Diego?
I'm from Georgia originally, Athens, Georgia. And when I was in elementary school, my family moved to San Francisco for 1 year. My dad was doing a sabbatical out here. And in fourth grade, I decided that my goal in life was to live in California. I just loved it so much. You know how you feel like you just belong in a certain place? And I was like, California is my place. As you all know, you don't always get to decide where you go for various schooling experiences. So I ended up doing college in North Carolina, grad school at the University of Kansas, and postdoc in Seattle. So I felt like I was just getting closer with every step of my academic career.
An internship back in North Carolina. So
Right. Oh, yeah. So I guess I went backwards. But I mean, I love North Carolina. I actually loved Kansas. I loved living in Lawrence, Kansas. Really appreciated so many things about Seattle, except the rain, which unfortunately is a big part of living in Seattle. And then ended up in San Diego for a job as a psychologist, which has just kind of grown from there. I've been in San Diego now for 14 years.
also, while you were on your walk this morning, we realized you got married in North Carolina too. You loved it.
Mm-hmm.
You guys forgot about your 15th wedding anniversary.
How do you forget about that? I don't understand.
She was in China at the time. I said something to Lucas. I was like, "Oh, Lucas, you all just had your 15th wedding anniversary." And he looked at me like, "Huh? That also just shows how like not self-involved Leslie is, which I love. She wasn't like, "Oh my God, we have to make a big deal about it." But was cracking up about that.
I did not notice that occurred, but yeah, you're right. Is that supposed to be like a silver anniversary or a gold anniversary?
I would want to go on a trip to like Bora Bora or something.
I mean, I was on a trip. It just wasn't with my husband.
Exactly. I would want to be with my partner. Okay, Leslie, what has been your most significant career achievement thus far?
There's several things that I feel really proud of in my career so far. I think becoming a trainer for behavioral tech is probably up there. Behavioral tech is Marsha Linehan founded this organization of trainers who specialize in teaching and training in DBT. And so joining that group felt like a pretty special recognition of what I've accomplished in terms of my career as a DBT therapist. And it's been a lot of fun to be involved with, the top DBT trainers in the world. That's a pretty nerdy accomplishment, but that's the one that I think I felt the most excited about.
I love that. And my mind is automatically going to, oh my gosh, well, I basically just continue to still want to be Leslie. So that's the next thing that I do. Okay, Leslie, if you were not a psychologist, what career would you be doing?
I don't know. And that is a question that pops into my head frequently. I think that being a psychologist, sometimes when you do a lot of individual therapy work, it feels like you're helping and affecting somebody in a major way, but it's only one person. So I think sometimes I look around and think maybe I should be in a career that is affecting policy change, that is helping with the issues that affect the world, like climate change or access to healthcare. I don't know that any of those jobs sound particularly fun, but I think sometimes I do have that feeling or drive of wanting to make a bigger impact in terms of issues that I care about. I also miss the artsy, creative, or I don't know.
That's what I was thinking.
Is the right.
I was thinking about when you used to make jewelry in grad school, and it was really beautiful.
I don't think that I am all that talented in things like art and creativity. But when I think about people, that is also a judgment. Yes. When I think about people that I'm envious of, it's like people who work in, fashion or art or performing arts, and like, wow, gosh, that's like a completely untapped thing when you're in a job like academic psychologist.
Well, now you're getting to live vicariously through your super musically and artistically talented kids.
It's totally true. My kids randomly are very artistic and very talented on stage, and I am 100% vicariously living through them. People may or may not have called me a stage mom at various times.
Because Leslie's kids have a band that performs.
Yes.
They're very cool.
They're called the Night Carrots. You can follow them on Instagram if you want to see the adventures of a band full of elementary and middle school students, all girls. So all girls pop punk band. They just this summer filmed their first music video, which is still being edited, but shall be out soon on the Carrots Instagram.
Gosh, your kids are so cool. I think something that I want to say, Leslie, in terms of like the creative piece, I think Marsha mentions this in the OG manual, is talking about just how there is a creativity piece in being a DBT therapist, because you have to navigate that balance between acceptance and change and kind of figuring out what your individual patient needs in that moment. And I feel like especially with like the irreverence piece and also the validation, there is some creativity. And you think about a lot of those irreverent strategies. Those aren't just like standard textbook things we do.
Yeah, I totally agree. Thinking about like, things that I want more of, but I'm a psychologist and this is my job. I mean, you guys have a podcast, so you're reaching and changing a bigger audience. I'm doing things like going to China and speaking to 500 people who, good point, so I think we're finding ways to maybe bring what we know how to do or what we were trained to do, and like finding a larger audience for it, not out of vanity, but sometimes it feels like you're kind of myopically focused on the one person in front of you and wanting to affect more people than that.
Well, yeah, and think about this, like all the people you supervise, Courtney included, like you're changing her patients' lives too. So that is super cool way to look at it. I like.
Yeah. One of my favorite questions then is, what is your most embarrassing moment clinically?
There's a couple moments that come to mind. Dr. Courtney, you were at UCSD during the pandemic and we all wore masks for years after the pandemic. So you actually might remember this moment. I had such a hard time with facial recognition with masks on. And at one point, it was probably a year and a half into the pandemic, but we were still fully masked at UCSD. And I had this patient and I saw her in the hall, said to her, hey, let's schedule our individual session for this week. When would you like to meet? And she looked really confused. And I kept pushing it. And we finally settled on, Wednesday at 11:30. And then I walked into the treatment room where all the patients were, and I saw the person who was actually my patient. And so I had just pushed a random patient who was not mine to make an appointment with me. And she was so confused, understandably, about what do you say if a therapist says, we're meeting, let's set up an appointment.
I hope you processed how easily she was persuaded or people pleased.
She wasn't my patient. Maybe she processed that with her actual therapist when they actually met.
She didn't show up Wednesday at 11:30.
So I realized very quickly. So then I went and tracked down the patient who wasn't mine. And I said, I'm so sorry. I had mixed you up with so-and-so. They're the same height. They had, hair that was approximately the same color and length. And they were both wearing their masks, as we all were at that point. And she was very gracious about it and, laughed it off and said, yeah, I was really confused why you wanted to meet with me. But I said, okay, sure, I'd be happy to meet with you if you want.
That's so funny. Oh, yeah. I love that. Okay, let's do one more. What is one dream you hope to achieve in your lifetime?
Well, I love traveling, and that's one of my very favorite things to do. And so the more I get to do that during my lifetime, the happier I'll be. I've really loved being able to show my kids completely different places and help them get a completely different perspective on life. So I don't know if that's a concrete enough dream for you, Courtney, but I want to travel as much as possible. I think you probably have the same dream as me, actually.
100%. Definitely. I'm going to Thailand in February.
Where are you going in Thailand?
I'm unclear because I haven't booked the whole trip. Well, I've just booked my flights and then I'm scuba diving. So I'm going on a liveaboard dive trip throughout part of the country for 5 days.
You will love it. So amazing, such a beautiful place to be, and a really easy and relaxing place to travel also.
I'm very excited. Leslie, this has been such a pleasure to have you on our podcast today. I have so enjoyed talking with you. It feels kind of like a full circle moment. For those of you that don't know, Leslie did her postdoc at EBTCS, where I now work, and then brought DBT to UCSD and has trained a lot of us in DBT throughout the years, which is pretty cool. And I think it is interesting to think about, Leslie, how many people you have impacted and taught DBT to, and then how we go on and continue our careers and then impact other people and supervise other people. So you've probably impacted a lot. It'd be fun to diagram that out someday.
It's like a Ponzi scheme, but for good.
Well, Dr. Courtney, thank you for being part of my Ponzi scheme. I really miss you in San Diego. And also, it is totally full circle that you went to EBTCS and you're now directing their eating disorders program and you're a certified DBT therapist. It's totally full circle.
Yeah, it is. And again, so much thanks to you and what you taught me about DBT. It's so cool to be here. And DBT, for those of you that don't know, I say this all the time, is my favorite thing ever. And I think Marcia is queen. So I just love having this conversation. It's been great. Okay, so Leslie, do you have any homework? You better work for us?
Work it, y'all.
I think that everybody should practice mindfully eating something this week. Doesn't have to be a Hershey's Kiss or a chocolate-covered Power Berry. You can mindfully eat absolutely anything.
Leslie, again, thank you so much for joining us today. This has been a lot of fun. For those of you that are enjoying this podcast, please make sure to go to barenakedshrinks.com to download your weekly homework. Stay tuned for our next episode with Dr. Jason Lavender when we talk about men and eating disorders called Boys Don't Cry. If you like what you've heard and seen so far, please follow us on Instagram, TikTok, and YouTube. And please rate, review, and subscribe to the podcast. Talk soon.
See y'all next time.